Hi, everyone. Welcome to another amazing conversation. Today, I want to introduce Dr. Edith Shiro. She has been amazing, and I know her time right now is worth more than anything. Like she's donating all her time for the people that have been affected with the Surfside tragedy. So the reason that I wanted to bring you here is because I have a lot of questions. And I know that it's in everybody's mind. But before I go into my first question, please introduce yourself and welcome. And thank you so much for being here today.
Gladys, thank you so much. I'm honored really to be talking to you right now. I so much respect and appreciate all the work you've been doing for the community since forever. And I mean, I'm happy to be sharing and talking about this because I think part of what in the middle of tragedy, what happens is like connecting with community is a very, very important thing to do. So, you know, the more we do this, the better.
Well, the reason I wanted to talk to you is because when it happened, 2 days after, my grandson came to me and said, one of the girls in my class, her grandparents are there. And at the beginning, I didn't even know how to answer. So we sat, we talked about it, but now that the days are going and it's been slow in the recovery, now we're going into the 13th day and hope is fading. How do we talk to the kids? How do we talk to the families?
Yeah. Listen, this is a super important question. And I do want to say that I'm a clinical psychologist. I've been practicing for many years, and trauma is my area of expertise for the last 30 years. This is what I do research in. This is what I've been working on most of my life. And one of the things that I also not only have the professional experience, but also the personal experience of living in New York for many years and going through 9/11. And Gladys, I feel like some of what we're going through now in Surfside, it's a mini 9/11.
Yes.
So it brings me back. It reminds me a lot of what I went through personally and professionally during that time in New York. One of the things about this trauma is how, you know, it has stages and, you know, it has timing. So how do we talk to families? How do we talk to the children about this? How do we handle it? First of all, everything, we have to understand that everything goes in time. So whatever we talk about now, it's not the same of what we'll talk about in a couple of weeks and in a couple of months and in a couple of years. So with children, I always tell parents, you have to go with the truth. There's not lying and making up stories are not good. Now, do you have to tell the whole truth in all the details and to gory detail and images and graphics? No. We have to be appropriate to each age, but acknowledging, first and foremost, acknowledging the kids' feeling, emotion, this validation of their worry. Do not go jump into assuming how they feel. We as parents, when our kids approach you as a grandmother, you know, when your grandkid says, my friend has a grandparents that are disappear or missing, you say, wow, and how does that make you feel? First question, how does that make you feel? What is that like for you? Because we don't want to assume that we know how the kid is feeling. Because sometimes we jump into conclusions and we want to fix everything and we want to give them solutions and everything. That's not helpful because we're missing the point. Then we go and explain and we say, yeah, this is a very difficult time. We do talk about the truth. And we say, yes, I am. You can share how you feel also because it normalizes the experience, which is the second thing. All this like sadness or fear or anxiety or worry, it's normal. This is what we're supposed to feel when a tragedy happens, when the loss happens, when there's some difficult moment. So We normalize the experience by telling the kids, it's normal to feel worried. It's normal to feel sad about your friend. It's normal to want to have questions. I feel like that too. This is what we do. And the third thing is to give the kids an understanding, like first and foremost, this is not something that happens every day, that this is an exception. This is something that it's, that it's unique, that it's, something that is not part of everyday life, and that there are solutions to this. We don't have to say, no, everything is good and everything is great, but we install in the children hope. And we make them explicitly understand that there is hope, there is a light at the end of the tunnel, that we as adults believe in that, and that we're here for them to work with them in this process, because they wanna feel like they're not alone, they're not isolated in these feelings.
But I get it. What if the family does not feel the hope?
I understand that. That's what happens at first.
Yes.
That's
the
what
family
happens
is
at
now
first.
feeling insecure. We are all living in condominiums. So
Yeah,
of
but I'm not talking. Wait, but I'm not talking about hope, that the hope of like, oh, people are going to be alive or anything like that. What I'm talking about,
no,
we
is yes.
we
I
have the
understand.
strength to overcome whatever feelings we have.
Yes, because now the hope that everybody's feeling alive, we all know that it's close to zero.
I don't want to say that now, I'm just saying that we have to meet everybody where they're at.
Even though that the IDF head said that in Haiti, they found somebody after 14 or I think 15 days.
Everything is possible.
So everything is possible, and yes. But there's some of the families that they're not feeling any hope. They don't know how to talk to their kids because for them, it's very hard as well.
Yes, as adults, we have to take some space and ask for some support before we sit down with our children, because there's no use in us having all this anxiety and not being able to, and putting all that anxiety in our children, and projecting all of that. So somehow as adults being able to say, okay, let me connect with myself and see what are my answers, how am I dealing with this, so then I can go and be of support to my child, is extremely important. And even if I don't have the hope, even if what I'm feeling right now is sadness and uncertainty, at least I know that I'm going there with those feelings with my child, also knowing that it's okay. That's what I'm saying. Like, you don't have to fix the problem. You don't have to have the answers, but you can, the message to the children is to say, I'm here with you. I'm normalizing this experience for you as well. And we're together in this.
And it's okay to feel.
It's okay to feel this way, and you're not isolated in your feelings. You're validating the feelings, and you're accompanying and facilitating for the child as an adult that you're there. You're there.
What if they want to watch the news?
I would be that's an advice that I always give. Graphics are much more intense and much more traumatizing than any word. So I am of the ones that would say, filter the images that your child is seeing. It's not helpful to see images that are traumatizing, because it stays in your mind and it's harder to deal with, and there's no need to have certain images exposed to be exposed to certain images. So be careful what your children see and not see. Filter the kind of information, not by lying ever, but really by knowing what they can be exposed to or not.
Okay, so my next question is, how do we go back and how do we project that feeling of being safe again? Because we all live Sunny Isles, Aventura, Surfside. It's buildings. 80% of the community lives in a building, and now you go into a building and something sounds, and you get really nervous. You think your building is falling down.
So that's very, very common. That happens when a trauma happens, when a tragedy happens. The after effects of being re-traumatized or becoming fearful or starting becoming more hypervigilant about everything around us. You know, we were talking before about, you know, if you come from Colombia, from Venezuela, from whatever, when you hear a sound, when you see something suspicious, you immediately go into, this is a terrorist attack, this is a bomb, there's something, you know, something going on. So that does happen. That's a common reaction. Now, that's an irrational thought because buildings don't fall down, right? But that's not what happens. The statistics show the normal statistics show. I know there's all kinds of things, global warming and everything, but it's the same as you know, crossing the street. It's the same as getting on an airplane. I mean, can you get into an accident crossing the street? Yes, but does that mean that you're never going to cross the street? No. Are you going to get onto an airplane? Yes, even though some people are very afraid of airplanes, right? So that kind of, you know, it's not like buildings fall. So we tend to go into this very, very irrational, like survival stage of like hyper alertness, hyper vigilance, looking at, you know, the context and the environment, seeing where the danger is coming from. That's what we human beings do when we are traumatized, when we feel there's a trauma, when we anticipate pain and danger. So our nervous system gets on guard, gets on alert mode, and gets into this state of like, okay, where's the danger coming from? Because we want to survive. So it's all very good that we do that. That's what kept us alive, you know, as a species. Now, having said that and knowing this rationally, we also want to make sure that we tell our nervous system to calm down, that there's no danger, you know, and this is how we regulate ourselves. This is how we sort of like contain our feelings, our emotions. Right now, we're in a very particular stage, Gladys, because we are what it's called ambiguous loss. What does that mean? That means that we're at a stage where we're in shock. We have no answers. We're in limbo. We're suspended in a time when we don't have a closure. There's no closure for what's been going on. There's no closure for us to start a grieving period, a mourning period, the loss, you know, it hasn't happened yet. And that's the most difficult stage of loss that we can be in. So I understand the level of anxiety and the level of fear and the level of trauma that we're in right now. Hopefully we'll have some closure, and hopefully my hope is that every single family has that kind of closure and that opportunity, and we as a community do too, because then, you know, we can enter the stage of accepting, you know, what has happened and go into the stages of loss and grief. And that's where we can begin to regulate our feelings and say, okay, there's no danger, you know, we can start calming down, we can start reaching out to each other in some way of like creating safety, creating connection, creating a sense of like going back into some sort of routine and some sort of like ordinary life.
Easier said than done.
Absolutely. That's why I'm saying this takes time. This
easier said than done, because for example, and I did these conversations 2 weeks ago with my cousins that were actually in the building, but they were able to get out. And not only, yes, they have been traumatized, but for example, their daughter that was not there, now she doesn't want her mother to go anywhere. So it's like the other part, not only them, but the people around them.
Definitely.
Like a phone call that drops now, everybody goes, okay, please call me back. Those are the little things that are affecting a lot of people right now.
Absolutely. These are like concentric circles, you know, that's why it's like a systemic experience. That's why this is a collective trauma. This is not something that happened to an individual. This is something that has happened to a collective, and it affects in circles, you know, like the families of the victim, the survivors, like your cousins, the families of the survivors, the community at large, the society, the country, you know, the culture. It really goes in in circles, and it affects all of us at different levels. That's why, for the more reason, like that sense of like beginning to have safe spaces and connecting with each other is very, very important, because this is how we co-regulate each other. You know, this is how we say, it's okay. I mean, I feel your fear, I feel your anxiety, and I am too, but let's support each other. Let's see what resources we have. Let's do something together, sometimes maybe to disconnect or something. You know, if you need me to call you, I will call you. If you want to go out with me, or for now, we're not going to go anywhere because we need a few weeks of like calming down. This is going to pass. This is, you know, we're in the initial stages of the shock and the trauma. This will pass. It takes some time and some work, but this will enter us another stage eventually. I know it's easier said than done, but we do.
No, but I get it. What are the symptoms that the families need to look for?
Yeah.
So that they can ask for help? Because I know that a lot of people can tell you, no, I'm okay. And they think that they are okay. But what can we look for before we really say, okay, you really need help, please?
Right. No, I love that question. Listen, one of the things that I learned, and that we learned from 9/11, you know, being a psychologist there and working with being a first responder, actually with the Red Cross, and working with the families also, the missing and the victims and all of that, is that we learned that jumping into immediate conclusions and rushing to do therapy and to worrying and to doing all kinds of symptoms, it's not helpful. It's not. At the very beginning of all of this, you know, what we're going to do is re-traumatize the person to go into like, okay, yes, you're this, you're that, you're afraid, you're anxious, you're depressed. You know, there's a period of adjustment, of people really tapping into their own resilience and into their own strengths, into their coping mechanisms. And it usually takes about 6 months. So before that, I will not worry to say, okay, there's something else going on, or this person is truly becoming a chronic traumatizer. So traumatized person. So things to look for: sleeping patterns. Is the person able to go back into micro rituals in their lives? Meaning, like, are they going back into some sort of routine? Is a person being able to, at some point, begin to express their feelings, their emotions, begin to talk a little bit about it without having it repressed? Is the person eating well? Is a person having different moods, like sometimes happy, sometimes sad, sometimes crying, sometimes laughing, like the whole range of emotions, and not just one, sort of like constantly laughing or constantly crying? Is a person able to relate to others, like open up to engage in relationships again? And I'm not talking now, a week from today, or 2 weeks or 3 weeks. I'm talking in 6 months. Because there's a natural recovery that we all have as individuals, as a community, as families, that we will get there. So it's the people that linger in that like emergency state that becomes trauma, and that becomes post-traumatic stress, PTSD. It's the people that stay in that state of alarm and you know, hyper alert,
that cannot move forward.
So they either stay paralyzed, they get frozen in that state of like fear, danger. And how does it manifest? By all these things that I'm telling you about: not being able to get back into a routine, not relating to others, having a lot of nightmares, flashbacks, you know, that are chronic, become more chronic. Then I suggest to really look more for like maybe professional help, and really at least pay more attention to what happens there. But we're not there yet. And I truly believe that the natural strength of the human being and of the community is going to show up, and the natural resilience show up, and we have to give a chance to that as well, with a lot of support, a lot of getting together, a lot of, connecting with each other. Even if when the person says not now, to know that they can count on you. Even the people that are the most affected are not ready to receive help or support, to say, I know I can count on these people. I know they're there for me. I know their presence is felt. So we can do that even without words, just to feel the presence and just to be there for others is good. It's enough sometimes.
How do you disconnect? How are you able to get home after hearing all the families, after giving all that support to everyone? How are you able to continue and disconnect?
Thank you. No, listen, I am the first advocate for self-care. Number one, I've been talking about self-care since day one with all my therapists and all the groups and everybody, because I've been through this, I've done this many times. I will not be able to function and help others if I don't take care of myself. So what I do is I make sure that I have a lot of support around. So I have my team of other therapists that have been with me in New York, that we have gone through this together. We share a lot. I talk a lot. Being able to talk with you about it right now, knowing that I'm in help, I tell you, it's something amazing. I mean, knowing that I'm helping other people makes me feel really, really good. I also take breaks. I also make sure that I sleep well and eat well, and laugh and have fun as well, or at least have moments in between all the sadness. At least have some moments of laughing or making some humor, having some humor, and definitely for me it's connecting with friends, with colleagues, and having those kind of conversations helps a lot.
Because everything now has been the help and all the appreciation has gone to all the fire rescues, the first responders, but you guys are there hearing everyone. So how can we as a community help you?
I think I've been getting a lot of support and good words, and people have been very, very generous and supportive in how they've been communicating with us. Honestly, I think they appreciated a lot what we've been doing. I always think that as a community, the creating spaces for us to share in an informal way, in a formal way, that's what helps. Creating little forum groups, sharing spaces, meetings that in which we acknowledge what has happened, and over time we can be doing this also. I think as a community that will be super helpful, not to pretend that it didn't happen and not to let it go, but really acknowledge it, process it, share it, and have those spaces to be with each other. I think that will be the most helpful.
Because, for example, when somebody gets hurt, they break a leg or they go into surgery, you can see it and they heal and everything. But
Right.
Mental health is very different.
Right.
And
we're learning, and I think the pandemic has brought this to the forefront finally, how important mental health is and how important psychological well-being is. And we know that you can't separate the physical from the emotional, from the psychological. It's all the same,
Yeah, but we're learning. But wait a second, because I would love your feedback before we run out of time. With the tennis player, with Osaka, that she was not able to do a press conference.
Mm-hmm.
She was not only fined, but she was so pressured that she had to quit the whole tournament.
Mm-hmm.
But if, for example, she had broken her arm, that would have been excused. Okay, you broke your arm, go to the hospital, put a cast on, and you're out for 1 month, 2 months. But emotionally, that's not acceptable.
True, but that's an example of how controversial was that we haven't gotten there yet 100%, but the fact that we even are talking about it and people are recognizing that this is an issue is already much more than what it was in the past. The fact that she has the freedom to express how she feels, the fact that it's validated that there's a whole group of people that are supporting her, that this is a conversation and a dialogue that we're having publicly already is a good sign. Meaning, like, you know, there's an acknowledgement that this is happening. Yes, not a lot of people recognize it, but a lot of people are, you know, so I feel like the more and more this is going to come up, and more is going to be part of our culture. Hopefully, that's my hope. And I'm working very hard to make that happen, that I can tell you.
No, that totally should be, it's like one of the priorities. So before we leave, and you just said that to create spaces, because a lot of people have asked me that when am I doing the next Power of the Heels event? But I feel I can't because of everything that happened and getting together. I feel like I'm being irrespectful in some sense. That if I bring people together and we get together, it's like not right.
No, it's the opposite, Gladys. It's the opposite. You bring people together and you acknowledge what's happening. You don't pretend that it didn't. You bring it into the conversation. It doesn't have to be about that, but you bring it as part of the conversation. The getting together, it's one of the most important things because trauma isolates. Trauma and tragedy isolates the human being, isolates the person, because every person feels like their fears and their feelings and their pain is only theirs. And when they begin to see that others are going through the same thing, or that they hear other people talking, like, you know, there's a sense of belonging that is crucial to heal. And that's something we need to do.
Thank you. Thank you, thank you, thank you for everything that you're doing for the whole community. Please let us know if somebody needs to contact you.
Absolutely.
I know that you can stretch so much because the day has so many hours. There are so many hours in the day and you cannot stretch them out. But if anybody needs you, please, can you tell us where can they contact you?
Yes, I mean, I do, but just so you know, I have a lot of people working like me. It's not me alone. It's me with a lot of other people that are doing the same thing that I'm doing. Please contact me at my Instagram, which is at Dr. Dr. Edith Shiro. So dr.edithshiro, or my website, www.dredithshiro.com. Those are the two best places to connect with me, and I'm here, and you know, anybody who wants to help and collaborate, I'm always open.
Thank you.
Thank you.
Thank you. Thank you. Stay safe and be well.
Amen.
Bye, everyone.